So Congress passed the big Republican budget bill that makes really deep cuts to Medicaid. And one question we've had here is, what is the connection between those Medicaid cuts and rural hospitals in North Carolina closing? Great question. Let's go into it. So rural areas are typically lower income than like a suburban or an urban area, and a higher share of people are uninsured. They don't have health insurance, their jobs don't offer it, or they don't make enough money. And there's a lower population density overall. So fewer people to support a hospital at all. But you break a leg, you break a hip, you're in a car accident, you have a kid, you have the flu, any of those things still puts you in the hospital, and hospitals are legally and ethically obligated to provide care to anyone who shows up in an emergency room. Over the last 15 years, North Carolina's rural counties have both gotten older and they've gotten poorer, and that accelerates all these problems. So those rural hospitals are providing all that care, but they're just eating the cost for it because there's no one to bill. Hospitals make money by billing the insurance companies for patients they provide care to. So if your patients you're providing care to don't have an insurance company, you're just eating a lot of costs. The Affordable Care Act, or Obamacare, helped solve some of that problem because it allowed a lot of those people who weren't insured to finally get health coverage subsidized by the government. And so suddenly those hospitals they were going to could finally bill someone for the care they were providing. But for 12 years before 2023, Republicans in our state legislature blocked Medicaid expansion, including Thom Tillis himself, who was Speaker of the state house at that point and personally responsible for shutting down any Medicaid expansion.
I am the Speaker of the House who signed the bill that made it illegal to expand Medicaid under Obamacare.
And during that time, North Carolina kept losing hospital after hospital after hospital in our rural areas. I think we lost 6 or 7 over that whole time. That's part of the reason why we have a rural healthcare crisis today. Over 600,000 North Carolinians today, very disproportionately in rural counties, have health coverage today through Medicaid expansion, and that has helped keep rural hospitals open until now. So the Trump GOP budget bill that just passed, it kills a lot of the subsidies for Medicaid, and that probably shuts down North Carolina's Medicaid expansion program, which could kick 600,000 people off of Medicaid. And without that pool of insured patients out there, those rural hospitals that have been kept alive until now are probably going to close. Now, as usual, there are more factors here. It is a complicated issue. Like the demographic aging of our rural counties affects this whole thing a whole lot. The corporate hospital consolidation matters a whole lot. There are different lines of business in hospitals, like certain services cost a lot more money. They're revenue drivers for a hospital, and people are driving to a big city to have those services done, which means that the rural hospital is missing out on that revenue. There's stuff like that going on as well, but the Medicaid expansion piece is by far the biggest part. So anyway, that's why cuts to Medicaid are going to lead to rural hospitals closing. If we want healthcare in rural areas, someone's got to pay for it. We had a system for this, and they broke it.